When coronavirus hit the UK, we saw hospitals being rapidly set up to take more patients, and even new ones were built. But in the last month, admissions to hospital emergency rooms have dropped to the lowest point since records began. Many hospitals have seen a decline in the number of patients coming in for emergency care or scheduled appointments due to the coronavirus. But technology is enabling safe social distancing while also ensuring that important issues aren't missed. Finding ways to quickly adapt NHS systems to remotely check on patients with acute or continuing illnesses has been an urgent task. We've been shown some of the ways doctors are working to carry on seeing patients without physically seeing them. Something as simple as sending an image on a phone is incredibly complex for the NHS. There are rules surrounding patient data that make it difficult to share scans, even between hospitals and doctors. But with coronavirus, doctors had to quickly find ways around this to enable them to work from home.
When COVID occurred, the approach to the deployment changed. The NHS has a number of challenges around governance arrangements. They have a lot of sensitive information, and sometimes they can be a barrier to deploying technology in the NHS. There was a very pragmatic approach taken by the guys across this region then to make sure that those final remaining steps were accelerated.
The Yorkshire Imaging Collaborative were already working with AGFA Healthcare on ways to share X-rays and scans among 6 hospitals using the Zero Exchange Network browser. But now the system is entirely accessible from home, meaning doctors can consult on critical patient care, including for cancer, from their living rooms, with no PPE required and no risk of spreading the virus.
I think everything's escalated, and over the last month I've really integrated it into my house so I can work almost exactly as I do at the hospital. All the data regarding the patient is all kept on hospital servers, which are all very secure. There's high level encryption. I have to use a special VPN network to access it. As soon as I log off, then there's nothing on my computer to identify that patient or any images remaining whatsoever. So if I had my computer stolen, there's no data on there. The only potential risk is when people come around sticking cameras through my window and have a look on the screen.
GPs too are finding new ways to see patients remotely. We're all now familiar with apps like GP at Hand and Push Doctor that allow you to see a doctor by video call on your mobile. The MedicSpot takes things further. These machines are in use in 318 pharmacies and 86 NHS care homes, hospitals and GP surgeries, including Dr. Yasmin Razik's clinic in West London.
That's it. You follow the video, so don't touch your forehead.
It moves beyond a simple video call with the doctor by giving the patient access to a blood pressure monitor, pulse oximeter. Did you get a reading? Stethoscope, contactless thermometer,
Wait 5 seconds. Lovely.
and even a light to check the ear, nose, or throat.
That's wonderful.
Obviously, we're doing everything remotely and digitally as much as possible for patient safety, but there are times we really do need to examine our patients. And so it gives us also that safety aspect that we can listen to the heart and the lungs, look inside the throat and the ear, and make a proper diagnostic assessment rather than just relying upon a conversation on the phone or a remote video.
The system cuts down on the use of vital PPE, as a doctor does not need to wear it and change for each consultation. This is very helpful, as at this surgery PPE is in short supply. While we were filming, a volunteer from a 3D printing charity dropped off a donation.
This is a face shield, and these are 3D printed. The black part has been 3D printed by somebody locally, and then we have cut the visor and the button elastic, and we're distributing them to frontline health workers. And it turns out there's a distributed manufacturing capacity across the UK to make 140,000 so far.
We have a need, and it's wonderful actually that you've come to support us, because unfortunately, as you were saying, through normal procurement lines we can't actually access PPE, and so GPs are having to do their best to find it from everywhere available to support their staff. I think it's amazing that you've come and helped us. I'm really, really grateful.
New apps are also allowing patients and doctors to interact remotely. Silo allows doctors to communicate with enhanced security, allowing them to annotate photographs and blur patient records so they don't have to meet in person, while Zesty helps patients access their medical records, book appointments, and even attend consultations online.
I think we are often guilty of being a bit slower to adopt technologies in health, but sometimes it takes a crisis like this to come out with a positive change, and I think it's really shown us that the benefits of adopting remote technologies to deliver healthcare, and we won't be going back.